It is a Think Tank Tuesday here on the morning show, and joining us right now via Zoom is a specialist integrative neurologist who really is able to think outside the box. We're joined by Dr. Ashleigh Bhanjan. Doctor, a very good morning to you and welcome to the morning show.
Good morning, Nelly, and good morning to the viewers. First, congratulations on the great show. Well
Thank
done.
you. Thank you so much. We really appreciate it, Doc. Doc, let's speak about your work. Now that you are commending our work, let's get into yours and let us in on your background and experience in neurology as well as laser therapy.
Well, Nelly, I've been a neurologist now for, the past 15 years. And I would say over the many numerous patients that we've seen over time, that there seemed to have been a bit of a missing piece of the puzzle, I would say, a bit of a void when it comes to patient treatment care and the treatment algorithms. I say this because a lot of patients still have ongoing disability, ongoing symptoms, chronic pain, discomfort, etc., that usual conventional medical therapies did not seem to help in the long term. And this is the reason why I have personally chosen the path of a bit of a more integrative approach, in fact, more functional medicine, and in fact, looking at holistically healing patients. And this is where the laser therapy treatment came about.
Sure.
It's been established now for the past 5 years or so, nearly.
So tell us then, Doc, about the Durban Neuro Laser Clinic and some of the things that you do and some of the conditions that you work with.
So we're using what we call low-level laser therapy. A lot of people will listen to the concept of laser and think, oh my goodness, this is some surgical procedure and some Star Wars related illness happening here. But really it's low-level laser therapy. So it's also otherwise known as cold laser. So we're not actually using heat as a mechanism to induce changes in the cells. So the more preferred term they use now more recently is called photobiomodulation therapy. A bit of a difficult term, but simply put, photo meaning light, bio meaning life, modulation, change. So changing life using light therapy. And what we found over the last decades is that specific wavelengths of light, specifically red and near infrared light, have a profound effect on cellular mechanisms, including activation of the powerhouse of the cell called the mitochondria. Some of the viewers will have remembered from biology days that the mitochondria is essential for normal cellular function. So this is what we actually target. So we target not just the symptoms of the problem, we actually deal with the problem itself. In most cases, we see in my practice is a lot of chronic pain syndromes, sporting injuries, lower back pains, patients who are not amenable to any surgical procedures because of perhaps an anesthetic risk or side effect to medications, for example. So we deal with the neurorehabilitation perspective, we deal with acute and chronic pain. And the best part about it is that the laser therapy comes with minimal side effects. It's non-invasive, it's safe to apply, and it's individualized to each individual patient.
Sure. I mean, Doc, now you're talking about things such as side effects, and those are some of the things and questions that one would ask themselves. A person would also want to ask about some of the benefits and the risks that are associated with the process. Can you share some of those benefits with us, or if there are any risks that are associated with it? What are some of those things that, as a patient, I probably need to consider first, or what would be some things that you consider as a doctor when I come to you?
I think off the top of my head, there are two major reasons why we wouldn't use the laser therapy as a treatment option. The one is treatment directly over a pregnant womb. Right. So for obvious reasons, that we don't know what from the literature and from the scientific research, what the effects are or by performing treatment over a pregnant womb itself. And the second thing is that we wouldn't treat directly over a tumor. And because of the effects of the laser therapy in reducing inflammation, it has the also additional effect of releasing nitric oxide, which improves regional blood flow. So this theoretically would be not a great thing in a patient who has, for example, a peripheral tumor. So those are the two major reasons why we actually wouldn't. Otherwise, we would tailor your treatment according to your needs. with your clinical examination, your history, looking at your imaging, your x-rays, your MRI reports, your blood test reports. And remember, each individual, Nelly, is different. Each individual patient has specific needs. So the improvements or the rates of improvement in each individual patient, it varies. So we have a rough guideline in depending on the treatment protocols and the diagnosis, for example. And we treat patients from ranging all the way from headaches, migraine, back pain, arthritis, chronic neuropathies with neuropathic pain, including neuralgias, to more recently, a lot of work has been done into the neurodegenerative disorders, including Parkinson's disease, as well as even dementia.
Sure. And Doc, for somebody who's listening to us right now, and they're probably thinking, sure, I probably need to pay Dr. Bhanjan a visit. Do I need to go and get a referral first, or can I come directly to the clinic and I'll be able to get help?
You can call us directly. I'm sure we'll be able to share our social media pages, our contact details. We're based at the Life Integrative Hospital as well as the Odyssey Medical Center at the moment. So you can contact us directly and we can set up an appointment where we will sit down, discuss the treatment options, go through your medical records, go through a clinical examination and propose a treatment plan going forward.
Right. And Doc, in terms of South Africa and just comparing us to our counterparts in the world, how far are we when it comes to research or when it comes to other trial projects, when it comes to neuro laser treatment?
So because the photobiomodulation concept is a relatively newer concept in the market now and being non-conventional, there's been a boom in the clinical research over the last, I would say, 5 to 10 years. And it's now extended from dermatological applications to neuropsychiatric indications. And I know we're promoting health matters and mental health care and stuff at this moment in time. So it's doing great with regards to treatment of neuropsychiatric conditions, depression, mood disorders, ADHD, autism, and the list goes on and on and on. And I think that in the near future, this will probably be the next best thing since the invention of penicillin.
Sure, and that sounds like great news, Doc. And for those contact details, Doc, where do we find you? How do we find the clinic as well?
So we're based at Life Integrative Hospital. The contact number is 031-261-5446, or alternatively, you could go on to our social media pages, the Durban Neuro Laser Clinic, or in fact, visit our website, www.durbanneurolaserclinic.co.za. All our information will be posted on there. We also have a YouTube link as well, where you can see our patients and video testimonials for our patients and their responses to the treatments thus far. And I think that just to keep an open mind, and there are treatment options available out there apart from conventional therapies.
Sure. Dr. Bhanjan, thank you so much for your time. We really appreciate it, and we appreciate the insights that you've shared with us this morning. That was a specialist integrative neurologist, Dr. Ashleigh Bhanjan, joining us this morning here on TMS. Let's take a short ad break. Do stay with us.